Welcome everyone to this fascinating session, Healing the Trust Gap, Privacy, Proof, and the Future of Health Data. So I'm a health journalist. I write for The Telegraph, the BBC, and other national newspapers. And medical data has been a big focus for me in the last 10 years. I've written numerous stories about the whole key issue of data privacy, security, what do we do about that? And that's taught me two things, really. I would say number one is that our data is not as private as we think it is. I've seen some scary studies which have shown just how easy it is to de-identify someone with just a handful of variables. And also, secondly, this space is ripe for disruption. And to discuss this, I've got two brilliant panelists with me. We have Jem, who is the founder of Nexifuse Health, and Tony Abed, who is CEO of Sovo. So yeah, guys, to kick off this discussion, I suppose, first of all, what would you say are the biggest weaknesses at the moment in our healthcare systems? Jem, I know you've told me some terrifying things about the number of breaches in the US every week.
I think the breaches are definitely a cause for concern. We don't want our most sensitive medical data exposed. But I think some of the weaknesses, and the most obvious one, is the fragmentation of that data and the lack of continuity of care as a patient. Whether you have to switch from provider to provider or from country to country, the fact that your medical data doesn't follow you in a way that you feel safe, secure, in a way that makes the data interoperable, I think that's the biggest weakness at the moment.
Tony, what would you say?
Thanks, Jem. Yeah, I do agree with you. That's the largest weakness. And then to build on that, when you take it from a public health perspective lens, one of the biggest weaknesses that you have is the consistency of how data is captured and represented to be utilized to drive regulatory decisions and things that can help the general public and the general populations to get over health crises and health situations, and to be a bit more proactive in how we treat some of our health issues that come up.
That's interesting. I mean, yeah, fragmentation is a huge issue, here, in the UK. You move of GP and your data doesn't move with you. And, I guess, would you say that's becoming an even more of a pressing issue now because, people are using more and more different platforms to store data?
For sure. I think, whether you're doing genetic or biomarker testing, lab results for various things, we are becoming more and more conscious about our health data. And we're seeing this with wearables as well, whether it's Garmin, Fitbit, or Aura. We are becoming more focused on improving our own biological markers. And with that comes this even more inherent fragmentation of data. We have many, many apps on our phones. We use multiple providers. And now that longevity is becoming more of a global point of focus, people are even traveling between countries to receive various, perhaps experimental treatments. And that data needs to be consolidated in a way that we can have full ownership of our most sensitive and personal information.
Definitely, definitely. I mean, and Tony, would you say as well, obviously, given our data is being stored on so many different platforms, security obviously is an issue, and is there that need to try and add additional security to all these electronic records which we're creating?
Oh, absolutely. I mean, just from a personal perspective, I have multiple wearables that I wear. So I've got the Ultra-Human Ring, I wear an Apple Watch for the most part, and when you look at what's captured on each of the devices, even though the data is fragmented and it's separated, they do feed each other. There are the back-end APIs that connect the system. So this is just at that very base personal level that gives multiple layers of super sensitive data in real time to different entities. And even though I'm willing to disclose that information to these entities, you don't know whether they're going to be hacked. The bad actors are going to go after these entities because you have the most vulnerable sets of data. And when you think of everyone goes to your longevity platform, your different things, but think of the mental health data that is being stored and being put into LLM models like ChatGPT. So people are putting the most personal layers of data and sensitive information that makes them more vulnerable to issues in the job place, issues in society, issues with their family and friends. And they're just releasing that data without thinking of the long-term consequences. So the security layer becomes more and more prominent and prevalent in and the need for it starts to grow as we see a rapid increase in the adoption of these LLM technologies.
That's a very good point, and actually OpenAI even recently came out and publicly said, please do not put your medical data in our system, because we can't guarantee that it will be protected long term. And I guess that is an issue. And Jem, I know you've kind of had first-hand sort of experience in your family of the consequences of a medical data breach.
The consequences are very large. I think especially 2 weeks ago, OpenAI came out and said, we don't want to provide any guidance on finance, legal, and health matters. And I think this has come about through a number of unfortunate cases, as Tony mentioned, in mental health, where the LLM is just not capable of providing that objective and very personal guidance to that person to bring them out of that situation. And I think that's what health guidance should be about. It's our most innate vulnerability, the things that we need help with. In the case of a recent implication, Change Healthcare, a very big insurance processor in the United States, had a very, very large breach in the millions and dozens of millions. And the only remediation for this is just the credit check. Because when that data gets breached, your medical profile, your personal information, your social security number in the US, and your address, it's all available. And that is all you need to steal someone's identity.
Yeah, I mean, that is frankly terrifying, so really when you think about the consequences of that. I mean, and perhaps then, that's a good opportunity to maybe move on to how blockchain technology can perhaps, solve some of these problems. I mean, I know that's obviously one of the big goals of the Midnight.foundation, and obviously both of you guys as well. So, just give us an idea of how can some of these new tools like zero-knowledge cryptography help tackle some of these challenges?
So this is exactly what I'm currently dedicating all of my effort to. I think there's been a lot of publications from academia that have proposed blockchains as the perfect infrastructure for medical records. However, a public blockchain with queryable data that's accessible to everyone is not the best place to store confidential or private information. When Midnight came around in its earliest of days, it became very obvious to me that this is the direction, if at all, healthcare and blockchain would progress in. We need that data to be selectively disclosed, which is exactly what we're building with Nexifuse. Your data becomes fully encrypted, secured, and at your leisure and convenience to disclose as you please in a selective way for the care that you're receiving at that point in time, exactly.
And Tony, talk me through also as well how some of these new tools can solve that fragmentation of issue, of having different bits of data stored in different places, and you really just need to amalgamate it together, to see what health trajectory you're on.
Yeah, absolutely. So in a previous life, I was consulting for the Canadian Public Health Agency and then the Canadian Blood Services. And in the Canadian healthcare system, the data is stored at a provincial level. So there are fragmented data sets with different standards, different requirements at each province that oftentimes don't speak to each other. So this is just in one country's simple example where Ontario's data structure and data requirements are different to Quebec's data structures and requirements. So when you put the EHR systems or a patient who's living at the border, like I did, I lived at the border of Ontario and Quebec. When I went over to Quebec for work, I could not get the continuity of care because the systems couldn't speak to each other. And when you have those minute centralized storage systems of data, you can't get that system. But when you look at the decentralized storage that have programmable prototypes that you can put together, you have the ability to put each of the parameters that you need, adjust that for the legal requirements, your regulatory requirements, the clinical needs. You can then have them speak to each other in a secure and confident private manner. So the healthcare use case is what got me into blockchain 5-6 years ago. And what was missing for me was the layers of privacy within that. So when Midnight was coming out and when they were announcing what they were building, it got me re-excited about the applications that blockchain can bring in the healthcare space.
Definitely. And I think one interesting layer of this discussion is, this panel is called healing the trust gap. And trust is a huge issue, kind of in this space. I mean, it's come up time and time again when I've reported on it. For example, I remember a couple of years ago, the NHS struck big partnership with Palantir, and that was the whole idea behind that, was to try and tackle this fragmentation, but people didn't trust it. That was the big thing which sort of came out almost immediately. So how do you think, what can we do to build public trust in these tools?
I think ultimately everyone that we have engaged, and we're currently active in 3 different countries, has highlighted the need for interoperability. They all want this, both within their own structure, but also, as Tony mentioned, in a national way that feels porous between provinces or jurisdictions or cities. And ultimately, unlike Palantir or Oracle, I don't want Nexifuse to be permanently ingrained as a service provider to these institutions. Obviously, we offer services to them, but one of the benefits of using Midnight is that it's a decentralized protocol. And we're not asking them to put their trust in us. We're asking them to put their trust in this verifiably secure protocol that a lot of industry professionals have staked their reputations on. And that is the promise of blockchain. The decentralized ledger is a way to shift away from a centralized entity controlling data, finance, or whatever is the pertinent component of that system.
Would you agree, Tony?
Yeah, absolutely. I fully agree with what Jem was saying. And then when you think of it from a technological implementation, so the proof is always in the pudding. So it's always on your ability to execute and to demonstrate that what you're building deserves the level of trust that you say and that you're asking for from society. So you build that over time, which is why in Charles's keynote yesterday, when he was talking about the length of time that it takes to build systems, and we're building an extremely complex infrastructure that has privacy built in. It's not an afterthought. It's not something that's plugged in after the fact and shoehorned into the system. It's built in from day one. So for an institutional adoption, and healthcare is the most sensitive data that you can get, requires the level of confidence that someone who's going to implement it would have in a fully trustable system. So I think this is the ultimate use case for a privacy-backed protocol.
And do you think, the fact that the decentralized nature of blockchain, obviously that sort of adds an additional layer of transparency, which people don't necessarily get at the moment with those centralized health systems. Their data is stored in one place and they don't exactly know how it's being used. Do you think that's maybe one of the opportunities here for blockchain?
I think very much so. We're seeing some very large industry players. I won't name any names, but they are indeed holding that data hostage. And the healthcare system is already a pretty difficult system in innovating technologies for. Doctors are not prone to innovations because they're operating at a very high pace in a very high stakes environment. So we're not seeing a lot of uptake in new technology, at least not easily. At the same time, we're seeing the most tangible uptake in AI applications in the medical sector. So ultimately, we need to build robust frameworks that are verifiably secure, especially if we're going to be sharing our most sensitive data with AI. And I think that will help us transition away from some of these data kidnappers, or let's say data miners, in a way that is fully decentralized. As much as we use Midnight and a decentralized protocol like Midnight, our core system architecture is also decentralized. And we have absolutely zero access to the underlying medical data.
Tony?
Yeah, absolutely. I think the decentralized nature and the privacy layer feed into your last question around trust. I think that's what builds the level of trust, which helps the level of adoption and implementation of these new types of technologies. And if you think about the last 10, 20 years of the internet and how we've moved forward, nothing online that you're using for free is truly free. You're paying for it with your data, and you have zero say over how that data is used, where it's used, who's using it. Right now, with this type of technology, you have that ability to selectively disclose where that data is. And from a healthcare adoption, not just from the user side of things, because I think users see that right off the bat, but large institutions, research agencies, pharmaceutical agencies, all of the different layers of users of this healthcare data can see that right off the bat, because it de-risks them in it right up front. Like, it de-risks them right up front before they actually start using that data, to have that trusted, secure layer that they can utilize.
That's a good point. That's a good point. I mean, and Gemma, you like to mention, you know, the challenges in getting lots of healthcare to invest in something new, and you know, like so kind of Tony, like so you mentioned, like so kind of ChatGPT, like so earlier as well, and I guess like LMMs, we're starting to see people talking about incorporating them like so into like so the healthcare system, and obviously that poses all kinds of like privacy challenges. I mean, I wondered whether that, you know, perhaps could be like the push, the kick, like so, which is needed to sort of push people like so into investing more in blockchain.
I believe so. I think interoperability is a big issue, and interoperability requires, in a way, a global infrastructure. Otherwise, the data that you pull is a very transactional. In the case of, let's say, a hospital utilizing OpenAI or any other LLM protocol, the most recent interoperability standards do not have selective disclosure built into them, which means that if I were to have the best standard for medical data, which would give me all of this information that I then feed into an LLM, that is not a secure protocol in any way.
Yeah.
And what we're trying to figure out at Nexifuse is what is the minimum barrier for institutions, providers, and patients to have a framework that they can trust, that makes them feel empowered. And I think that's blockchain.
Yeah.
That's exactly what blockchain is trying to do, empower people in a non-centralized way.
Yeah, yeah, yeah. Tony, have you found the same?
Yeah, absolutely. So from our venture studio's perspective, we look for projects, we look for entities that can truly integrate and plug into existing systems. So instead of trying to rewrite the entire industry, rewrite how things are done, you find elements like that, right? Almost like a middleware type of product that you can integrate with that very thin layer of effort to utilize it and to see the results right off the bat. You want to drive that hype, you want to drive the true demonstration of value right through it. And I think this allows that plug into existing systems that will actually drive true change and true adoption.
Interesting, interesting. I mean, and, you know, where are you seeing lots of the early adopters, you know, so far, lots of in the world? And, you know, what do you think it would take to kind of see, you know, for example, say the NHS, lots of embrace blockchain?
That would be definitely a monumental decision for the United Kingdom. I think ultimately we're seeing this in every country that we have tried to target so far. We did expect some reluctance, obviously, because it's a brand new technology, but you know, ranging from California all the way to the Middle East, everyone seems quite keen on this type of innovation. This type of innovation that, one, provides security, two, a trustless system that everyone can tap into, and we believe that Midnight will provide that as it continues to build. But furthermore, with Midnight's zero-knowledge capabilities, the things we can do with medical data are really exciting. Over the coming years, we will work very closely with the Midnight team to really fully utilize the infrastructure that they have built. We believe that there will be a time in the near future where I, as a patient who has medical data, can perhaps even commercialize my medical data. Currently, we're seeing that data mining, anything you provide your data to, is most likely going to be sold, even if not today, later, when that company is acquired by someone else. And in this way, if I can provide a zero-knowledge attestation of certain medical information that I'm willing to disclose to a pharmaceutical research company or a government or anyone else, we could track when that data is being used in an immutable way, but perhaps I can also be compensated through the blockchain for the data that's being used.
That's a fascinating example, kind of a sort of re-empowering the patient, like sort of in some ways. I mean, are you able to sort of give us any sort of early examples of where, you know, where that might first take place?
Yes, currently we're working on clinical research applications.
Okay.
We know that research institutions want to collaborate. However, everyone is very sensitive about where that data is located. With Nexifuse's architecture, we're able to give them that security and comfort that satisfies their IRBs, their internal review boards, and to give them this ability to collaborate and commercialize. And what that means that, if you're part of a network of, let's say, children's hospitals across the United States, and you're not very keen on sharing the data that you have accumulated over time, we can create this decentralized, trustless mechanism using zero-knowledge attestations and other methodologies to have these institutions benefit from that data without compromising the underlying concerns.
Interesting. And Tony, I know you're working in Barbados, like, a lot at the moment. Is that one of the early sort of use cases, you're seeing in their healthcare system?
Yeah, absolutely. I've been in the health tech space for just about 2 decades now, started when I was 10. And it's incredible to see the lack of friction that's being brought to the conversations that we're having about the adoption of different layers of blockchain solutions in the healthcare space. I've seen it through the provision of free-to-use healthcare software in clinics and hospitals throughout Canada. And what we're seeing right now is people have embraced the technology. They've embraced the need for change. And I think it goes back to what we were talking about the trust component to it. It has been a system that's been out there long enough that people are starting to trust it. They're starting to see this is something we're willing to take a risk on. We're willing to make a move towards implementing in small proof of concept ways, as you should, but we're starting to see the conversation moving that way.
Yeah. Of course, I mean, we're running out of time, but just like sort of a couple of final things which I wanted to sort of touch on with you guys. I mean, I guess first of all, just quickly, what would you say is like sort of, kind of the biggest areas of resistance sort of at the moment, like sort of, and how that can be overcome perhaps?
Currently, our biggest excitement and hurdle is the launch of Midnight on mainnet. I think once that does happen, we'll be ready to turn on the light for a lot of these institutions that we've been working very closely with. I feel very grateful that we're able to overcome some of the long sales cycles. Barbados is a very innovative hub. They have multiple medical academies, and they have a high output of very intelligent doctors. And everyone seems very excited to implement this. I would like to believe that currently there are no major hurdles in front of us.
Tony, would you agree?
It's an interesting point, and I think it goes back, it's not unique to the healthcare space. I think it goes to the blockchain space, the Web3 space as a whole, is that fear in building and deploying and selling to institutional grade implementers of the technology. So for me, there's still a hurdle around the education on the platform, education on how it can be used, and the level of value that's brought to individuals who can utilize this and see like real-world demonstrable proof. So for me, it's from the builder's perspective, we've been hit down so much, and there's been almost been building in the shadows and in fringe communities for so long that I think it's getting over that fear and building with a layer of confidence to deploy these types of products.
And finally, I guess just 30 seconds for each of you. Where, do you think, this is all heading? What can we expect in, the next 5 years?
I think we're going to see a lot more ownership of our personal information. I would like to see the vision of blockchain fully realized, where self-defendance and self-sovereignty is more present in our daily lives. For me, that's medical data. That's what I will put all of my effort into, and I would love to see that come to fruition.
Tony, where are we going to be in 2029?
Awesome. 2029, eh? So for me, it's seeing systems that provide more proactive utility of healthcare platforms. I don't want to be in a situation where I'm reacting to a healthcare issue for myself or my family or my friends. It's more being able to utilize platforms, utilize the technology that we have available, that we can proactively address these issues before they risks before they become issues.
Fascinating. I mean, well, thank you guys. That has been an illuminating and just really eye-opening kind of talk.
Thank you so much.
Thank you.
It's been a pleasure. Thank you all.